So he'll be speaking on post-cataract surgery and ophthalmitis, presenting as retinal vasculitis. Yes, please start.
Good evening, everyone. So I'll be presenting a series of patients where they initially presented as vasculitis in a post-operative period and later turned out to be endophthalmitis. So a brief introduction where we know this is a dreaded complication where the incidence is, even though the incidence is very less, but nobody wants to see this type of complication, and the incidence is around 0.1% in post-cataract surgery and 1 in 5,000 injection post-intravitreal injection. They usually present with profound sudden loss of vision, conjunctival and anterior segment inflammation, hypopyon, glaucoma. On the day of presentation, anywhere from day 1 to 6 weeks, like in case of fulminant endophthalmitis and chronic endophthalmitis, it is 6 weeks. And the average duration is 6 to 9 days. And sometimes we diagnose when they are not responding to topical medications or oral medications. So these are the various kind of presentations. One thing is that we should get a B scan done whenever there is a suspicion. The most common organism is Staphylococcus aureus, Coagul is negative, Streptococcus, some gram-negative species. The most practice we routinely follow is give an intravitreal injection and wait for 24 hours to see the response. If there is a response, we repeat it after another 24 hours, or we can plan a vitrectomy if this is not responding, or early vitrectomy is also a better option. So in all our cases, patients, where 3 cases we have noted, in 3 patients we have noted these kind of symptoms. They were all precautions were taken. Intracameral moxifloxacin was used, adequate betadine contact time, patching time of 4 to 6 hours, and in post-operative period, patient was given moxifloxacin and dexamethasone. So this was the first case. Patient was operated for mature cataract. So pre-operatively there was no fundus examination, that was not possible. As you can see, there is a dense, patient came with a history of floaters and mild fallen vision. Patient had vision of 6/12. As you can see, there is a sheathing around the inferior vessels with white-centered hemorrhages and disc edema. So since it was a mature cataract, and in day 1 and day 2 there was significant corneal edema. Once the corneal edema resolved, we saw this patient on day 4. Initially we thought it as a missed vasculitis, looking at the OCT picture and also vessel involvement. But the next day the patient presented with full-blown end-off. So patient was taken to immediate vitrectomy. The one thing I wanted to show in vitrectomy is this presence of sclerotic vessels in the periphery. But luckily patient did very well. After 2 weeks, all those sheathing and all those kind of hemorrhages resolved, and patient did well. And within a span of 4 weeks, we saw another patient in post-operative period at day 5. Patient presented with floaters and mild fallen vision, and we could get a FA, and we could make out the vessels involvement. Since we had already had an experience with a previous case, this is the third case. This patient also came with a history of floaters and hemorrhages and kind of a vasculitis picture. So these are the 3 patients. The most common presentation is either mild falling vision or floaters or mild redness. Other than that, patients were mostly having 6/12 or 6/18 vision. So in the last 2 cases, we directly treated them as a post-operative endophthalmitis, gave vancomycin and dexa, and one of the patient needed vitrectomy also after 2 days. The sample we recovered Staphylococcus epidermis, which was moxi-resistant, vanco-sensitive. All patients recovered good vision at 3 months. Vascular signs surprisingly got recovered. So we went into the literature and saw so many case reports which were documented earlier. So this was a case report where ranibizumab post-ranibizumab patient developed vasculitis, and few other case reports where they could see hypopyon in the posterior pore also, where I could also make out during vitrectomy. These are the new fresher reports, and there are reports dated back 25 years also. Hemorrhagic vasculitis turned out to be endophthalmitis. So patient presenting in a post-operative period with a mild pain or very small, less drop in the vision, but if there is a floater, this should be considered as a, and patient should be worked up. Thorough retinal examination should be done. and whether it is related to moxie-resistant bacteria or whether this patient, why this patient presented initially with vasculitis, we don't have any additional literature. But very good thing is that these patients are managed as the existing guidelines of endophthalmitis. Thank you.
So what do you think vasculitis can occur in which form of endophthalmitis? The vessel involvement in the beginning can occur in endophthalmitis also, that too endogenous,
Yes.
not like this.
Yeah.
So this may be the first initial cases. Or do you think in the post-op endophthalmitis the vascular component, because of toxins, the vasculitis has already started? Or you were the first one to detect in the early phases when media was like...
Yeah, might be that we detected early. And might be the anterior inflammation got subsided with the medications, or my anterior segment was fine and everything started with the posterior thing.
But you have detected early, that is why you could see the posterior segment.
Yeah. But whenever we do vitrectomy, otherwise also, which are detected normally, these kind of presentations will be there when we do the vitrectomy, but these patients surprisingly presented with retinal finding initially.
So what was the culture reports in the other patients? Could you correlate it to some kind of etiology?
Culture, all three patients were positive for Staphylococcus epidermis, and they were all sensitive to vancomycin.
And sometimes you may see these kind of vasculitic picture in severe post-op inflammation also. It needn't be an endophthalmitis. So how would you suggest that we differentiate the two? Very severe, some inflammatory reactions. Yes,
but
you do
since
see
the
that.
vitreous is involved and retina is involved, and in the first patient we saw on the day 2,
and they were all culture positive, so that is why it was endophthalmitis. It was an inflammatory. They all were culture proven cases of endophthalmitis. Just a comment, in your first slide you said the ideal presentation of endophthalmitis is this. There's no ideal presentation, it should be the usual presentation.
Thank you.
Okay.